Good evening. Welcoming all the viewers to the brand new session of Ziksha Ayurveda series by Ayas Ayush. Before going into the session, I would like to say one quote from Hitopadesha on the aspect of skill development. Kalpete yen vrittam yen cha loke prashasthiti sadbihi sagunastena cha gunina rakshaya samvardhaniyascha. The skill that sustains livelihood and which is praised by all should be fostered and protected for your own development. Today, in our session, we are going to see on the diagnostic method and treatment principles of Amavata on the Ayurvedic perspective by the eminent Vaidya, Dr. Raguram YS. Welcoming you, sir.
Namaste. Thank you, sir.
Thank you. Dr. Raguram YS, professor in the PG Department of Kaya Chikitsa, A.L.N. Rao Memorial Medical College, Kopa. It's really gonna be a brainstorming session on the clinical aspects of Amavata. So, without any much delay, I would like to welcome Ms. Devi Priya, the final year BMS student from Government Ayurveda Medical College, Nagarkoil, to give us a brief introduction of our speaker and on the topic. On to you, Ms. Devi Priya, please.
Thank you, sir. Vanakkam, and a very warm welcome to everyone connected with I Ask Ayush. I am Devi Priya Balamurgan, co-host I Ask Ayush Ziksha Ayurveda series. We'll take immense pleasure to welcome Dr. Raguram YS sir, MD Ayurveda, Professor, Department of Kaya Chikitsa, A.L.N. Rao Memorial Medical College, Kopa. Sir had completed his EUG at Tarnath Government Ayurveda Medical College, Ballari, Karnataka in 1996 and PG Kaya Chikitsa at A.L.N. Rao Memorial Ayurvedic Medical College, Kopa in 2008. Sir have 23 years of experience in both clinical practice and teaching. Currently working as Professor, PG Department of Kaya Chikitsa, LNR Memorial Ayurvedic Medical College, Kopa. He had contributed hundreds of articles on various topics of Ayurveda for Easy Ayurveda, a popular Ayurvedic educational platform. Also, given many talks in popular Kannada TV channels. Today, we are much eager to receive your speech regarding diagnostic methods and treatment principles. Offer the session to you, sir. Good evening, sir.
Thank you. Dr. Devi Priya. So thank you for the introduction. Thank you, Dr. Hari. Thanks to Dr. Ilan and thanks to Dr. Samuel and the entire team of I Ask Ayush. So it's a wonderful journey you people are having, and I'm glad to be a part of it. So shall I start my presentation right now?
Yes, sir. You can.
Thank you. Thank you so much. Is it visible, doctor?
No, sir. Not yet. Yes, sir. Now it's coming.
Now it's coming.
Yes.
Okay. So I'll start my presentation with this. So prayer to Lord Dhanvantari, Om Dhanvantari Namaha. So may Lord bless us all in doing good works for Ayurveda. So as I have been introduced in this particular session by the doctors who are coordinating this particular session, I'll be touching upon the Ayurvedic perspective of the diagnosis and also the treatment aspects as far as Amavata is considered, without directly jumping into the conclusions of comparisons of Amavata with some modern diseases. I will put light and focus on the topic with the perspective of reading and understanding Amavata as Amavata. At the end of the session, I will plug in few terms from the modern conditions where Amavata has tried to be correlated to different conditions. But through the entire session, I'll be handling Amavata as Amavata. So this is a perspective mainly for the Ayurvedic students who are aspiring to practice Ayurveda in actual terms and to see the conditions through an Ayurvedic vision and also lens, and try to analyze the condition, the disease, the pathological condition, the stages of the diseases from our perspective. So with this, I would like to go ahead with my presentation. So you can see. So this is the topic, and that is my short introduction. Already I've been introduced with. So you can see the painful conditions here. So Amavata is a disease which starts from the stomach or the gastrointestinal system, according to Ayurveda, and then proceeds to the multiple systems, as we can see through the clinical features explained in Ayurveda. So it is a painful condition. Where exactly the pain comes and where it isn't, we will see as we discuss in this particular session the topic. So I'll go ahead. So you can see, so as we know, all the diseases have their origin from Manda Agni, unless proved otherwise. All the systemic diseases are having their origin from Manda Agni. So our basic aim, whether it is Kai Chikitsa or any field, will be to analyze or start analyzing the conditions basically from Agni. So unless proved otherwise, I'm telling. So there are other branches of Ayurveda. So unless proved otherwise, we are going to look into the Agni. So the facts and figures of Agni. So I'll be handling this particular session in different sections. The first section I have named it as the foundation, where we will get the foundation knowledge of the disease and the components of the disease, including armor. So already I have said what is Amavata. Amavata, from a different perspective, it is a disease which starts from the stomach and ends up in the whole body. So it includes bones, joints, and the soft tissues, and also the organs and organ systems of our body. And that is why Amavata is precisely a systemic disease. In some conditions, it is purely systemic, and in some conditions, it looks like a painful condition or a rheumatological condition, or in the form of an arthritis. Okay, so it is a systemic disease involving the joints, bones, and the soft tissues of the body. So we will understand the disease as we go ahead into the discussion. So what are the participants in crime? If Amavata, if the disease is a crime, then there should be some criminals. So there are two criminals in here, the participants in crime, and they are also the partners. It is Ama and Vata. So by telling Pittam Pangu, Kafam Pangu, Pangavo, Maladatavaha, Vayuna Etra Niyante, so we have given due importance to Vayu. And also by telling Vayus Tantra Yantradaraha, we have given due respect to Vayu, telling that almost all the activities in our system are carried over by Vata, and almost all the mischief or the pathological conditions are also either caused or triggered or carried or manipulated or presented by Vata. So Vata is a big band master in our system, and he is also the boss. Vata is also the boss, so which carries on good things when in balance and bad things when disturbed. So Pitta and Kapha also will be associated with Ama as partners in crime later. In this condition, Amavata, Ama and Vata are the participants, not only participants, but are also the partners in crime. That is why I have named that word partners in crime. So we know about a lot of things about Vata. Here, since it is Amavata, I would give the privilege to Ama and then Vata. So because it is not named as Vata Ama, it is named as Amavata. So I'll give the first privilege to Ama. That is why it is in red there, and then comes the Vata. So wherever Vata is disturbed, we have some painful and disturbed conditions in the system. And same is said about Ama also. So you can get a reference from Sushruta, where Master Sushruta tells Yatrastamamam Virujet Tameva Desham. So he tells wherever there is ama, wherever it is localized, wherever it is situated, the disease can be found at that particular place. Viruje, the painful conditions can be found at the place where ama is located. So similarly, the painful conditions are seen where vata is disturbed. And when we add up ama with vata, so we can see that they become very powerful combination, very deadly combination. And so we can just imagine if ama can produce painful conditions and if vata can produce painful conditions, when they mix up, what range of problems they can produce. So this is one of the dreadful conditions. In Madhava Nidana we can also find a reference where it is said sa kashtaha sarvaroganam. It tells it is very difficult to handle. Among all the diseases, it is very difficult to treat, and for the patient it is very difficult to bear. So what is ama? So ama, I don't want to jump into too many details about these things. We can see ama is defined or explained by different terminologies. So we have amavisha and then ajirana ahara. We can see all these things indicate the pathological elements or the pathogenesis or the site of pathogenesis or the element of pathogenesis associated with ama. So we can say when it is mentioned ajirna ahara rasa, we clearly know that when we have ajirna, definitely ama will be formed, and this is a cycle. Ajirna ama, this is a cycle, and more ama accumulates in the body, it will become ama visha. And that ama or ama visha, when it is put into circulation, they can get lodged during the sthana samshraya stage. They can get lodged in various organs and tissues and then produce the diseases. So ajirna and ama are the basis of this particular disease. Apakvan rasa, yes, and then stage of indigestion of food. Amaya. So the word Amaya also comes. Amaya is a name which is a synonym for Roga or Vyadhi. So here we can see Ama, Amaya. Okay. So since it is Amaya is a synonym for Vyadhi, we can see the importance of Ama because the derivative word there is Ama. So then Malasanchaya. So isn't it very easy from this perspective to understand this particular disease? When there is Malasanchaya, when there is a lot of Malasanchaya, Mala is also a term given for Dushta doshas often. When there is a lot of accumulation of unwanted things in the body, it is ama. So when it is ama, it will give painful conditions. So and then pratama dosha dushti, so it is called as an avipakva dravya, very important. So it is an unformed, unprocessed element in our system or the material in our system which keeps bothering, unwanted, avipakva, unprocessed, okay, uncooked, unripened, whatever we can call. It is not needed for our system. So coming to the definitions of ama, amyate, pedyate, srota samuho, anena iti ama. Pidyate, see that word there, pidyate. So it produces painful. So wherever there is ama, there is association of that word pida with ama. Okay, ama, pida. Okay, pida is equal to pain. Pida is equal to shula. Pida is equal to vedana. So amyate, pidyate. So in continuation itself, it has been said. Sroto samoho anena. So it not only bothers the entire system, but also it also bothers the entire sroto samoha. So what is our entire system? The body. The body is composed of srotas. isn't it? So the entire system, the entire body, the entire configuration of the human system itself is made up of many srotasas. So here, amyate pidate srotosamuha. So when this disease or when this ama produces painful conditions or obstructions leading to painful conditions in these srotasas, so it is very difficult to bother. So that which is having a capacity to block, clog the srotas and also produce painful conditions is called as ama. Other things we know from the famous quote from Ashtanga Hridaya Sutra, Ushmana Alpa Balatvena Dhatumatyam Apachitam, Tushtam Amashaya Gatam Rasam, Amam Prachakshite. Amashaya Gatam Rasam. So the manufacture center and the distribution center for ama is amashaya. That is why amashaya is called as ama ashaya. Ama ashaya. The first ama is produced in amashaya. Okay. So ushmano alpa balatvena. Why it is formed? Because of the low strength of the digestive fire. Ushmano alpa balatvena. Low digestive fire or low strength. Alpa balatvena ushmano. Low strength of the digestive fire. So this is ama. Is ama formed in everybody? Yes, it is formed in everybody in the first stage of digestion. It may not produce, it may be a physiological process, but when there is accumulation beyond control or in excess, it will definitely lead to the manifestation of diseases. It will be disease causing. So then Amashayasa Kayagnehe. So it is a similar explanation we can find in Madhava Nidana. Amashayasa Kayagnehe Daurbalyat. So the basic origin for formation of ama will be the Kayagnehe Daurbalyat, the weakness of the digestive fire. The weakness of digestive fire, so leading to the production of ama. So that is the etiological factor. That is the root principle there. Adya Ahara Dhaturiha sa ama iti kirtitaha. So that is one of the famous quotes. So we have a lot of quotes here. Ahara Sarasa Shesho. Yo anapakko Agnilagavat, Agni Mandhyat, isn't it? So when the digestive fire is less, aharasya rasa sheshaha. After even after the digestion of food, some things, some elements are left over which are not needed to the body, and they will be called as ama. Samulam sarva roganam. You can see them marked in red. Sa moolam sarva roganam. Ama iti abhidiyate. Wonderful explanation of ama. So here the author is trying to tell that sa moolam. So it is the root cause for many diseases, or rather all diseases. Sarva roganam. So similar explanation. Jatranala dorbalyat avipakustiyora sa ama sangnako dehe sarva dosha prakopanaha. Again in Madhukosha Tika we can find ama is considered to have the capacity or the strength to cause sarva dosha prakopa, isn't it? So it causes sarvaroga and also it causes sarvadosha prakopa. So immense capacity this ama is having. Avipakvam asumiktam. This is the nature of ama. What is the nature of ama? What are the qualities of ama? It is avipakva, it is asamyukta, it is durganda, it is bahupichila, sadanam sarvagatranam. It is going to produce difficult conditions or a tiredness or weakness or lethargy in the entire body, all associated with the pain. So these are the characteristics. Anything in the body which has these things. So take the other way, turn the mirror and see and try to analyze this particular one. So sadanam sarvagatranam avipakvam asamyuktam durgandam bahupichalam. Something these kind of things are found anywhere in the system. Manifestations, the person is having avipakva asamyuktam durgandam bahupichalam. So and sadanam sarvagatranam and avipakva, first clues towards the formation of ama and also the clues that ama related diseases will be formed in the future. So this is a reference from Bhava Prakasha. So then I'm not going to read all the shlokas here because of the time. I have a lot of slides here. And Dushtebhyo Anya Murchanat. So here, so they Doshebhya Evati Dushtebhyo Anya Murchanat. So it is also formed by a horrible type of admixture or amalgamation of these dushta doshas. Ama is formed due to those. Okay, the example is given. Podravebhyo vishasyeva vadanti amasya sambhava. So then apacchavanam shuktatvam. So shuktatvam. So once the indigested material is left out in the system, more ama is left out in the system or in the tissues, wherever there is accumulation of ama, there you can find shuk tattva, like a food which is kept for long duration without being protected, it gets the shukta bhava. or it gets fermented, or it decays, whatever we can call it as. Such an environment, such a decayed environment is produced in the system wherever there is excessive accumulation of ama. So yati annam visharupatam. So from there on, the food gets the visharupa. So what we take it as the supportive things for the body, like anna, that same anna, when it is left out for a longer duration, when it is not properly digested and converted into ama and gets shuktatva, later it also gets the visharupatam. So it becomes a toxin, it becomes a poison, becomes a unwanted thing for the body. Amalakshana, we can see Srutoroda, Balabramsha, Gaurava, Anila Mudata, Anila Mudata. So obstruction of vata in the body is Anila Mudata. Alasyam Apakti Nishtiva, Malasanga, Aruchi Klamaha. So these are the ama symptoms. So you can see the translations there. And we'll come to the Nidana Adi of Amavata. So like Nidana Panchaka. So Nidana, so we know Viruddhahara, Viruddha Chesta, we're all used to this Viruddhahara. So nowadays, so our food is not being properly monitored, our lifestyle is not being properly monitored. Mandagnehe nishchalasya and snigdam bhuktavato annam gayam kurvatastata. So taking for granted that most of our viewers know about Ayurveda. I'm not going to into the details of certain things. Wherever the focus is needed, I'm just focusing. So since Viruddhahara and Viruddha Chesta are the predominant nidanas for Amavata, we're all susceptible to get Amavata. Or probably at one or the other point of our life, we would have gone through one or the other stages of Amavata. So Master Harita gives some extra nidanas like Guru Anna, Ahara Pushtena, like the person who is nourished, the person who is nourished by Guru Ahara or the Guru Anna, hard to digest foods. The person who is taking such type of Ahara, Guru Ahara, very regularly, and the person who has been substantially supported and also nourished by Guru Anna, these people are prone to get Amavata. Those who are regularly having Mandagni, those who are having Vyavayanaha, see here, Vyavaya also he brings into the, so abnormal sexual practices. So and Tarpitaihi Kanda Shakeshu, the person who is Tarpitaha, the person who is satiated, the person who is nourished, the person who is what we can call it as Trupta. Due to Tarpitaha is Trupta by regular consumption of Kanda Shakeshu. We should remember whenever the nidanas are mentioned for any disease, maybe Amavata or any other disease, the nidanas pertain to over usage, excessive usage, or adhika or vishama pramana. So these things, and somewhere Hina also will come into the question. That we will not bother about here. These etiologies, whatever we are seeing, the nidanas are due to excessive usage. Purvarupa Famavata, we can see that the Ayurvedic texts have not mentioned Purvarupas for many diseases, and same is the condition for Amavata. We don't find Purvarupa explained for Amavata. So, what is the basic knowledge is that whenever the Purvarupas of any disease has not been given, the Lakshana Samuha or the symptomatology of that particular disease in their feeble manifestations or earlier manifestations should be considered to be the Purvarupas of Amavata. So here you can see Samavata Lakshanas and gut level symptoms. We have Samanya Lakshanas when we go through the Madhava Nidana explanation of Amavata. Initially, there are Samanya Lakshanas which are given, and then the Acharya explains the Pravruddha Amavata Lakshana. I would take the Samanya Lakshanas as those Lakshanas which are initially manifested at the gut level, and Pravruddha Amavata as the widespread disease which has gone to the systemic manifestation. So even when seeing the symptoms also, we will get a similar idea. So the Samanya Amavata Lakshana, what have been explained in the text, or the gut level symptoms, the symptoms of Amavata not manifested at the systemic level, but manifested only at the gut level. And also the Samavata Lakshana. We have another condition. Amavata we have another condition called as Samavata. Okay. So the Samavata Lakshana and Samanya Lakshanas of Amavata taken in their feebler manifestations can be considered to be the Purva Rupas of Amavata. They give us a clue that a bigger disease called as Amavata is approaching us and it is about to haunt us in near time. Okay, so now, as I said, Amavata and Samavata are two different conditions. The symptoms itself differentiates them. Amavata is a disease, Samavata is a condition where Ama is associated with Vata, but the dosha dosha samurjana has not taken place. Where? In Samavata. In Amavata, Ama is associated with Vata here also, but the dhatus are invaded and the disease is formed. We know that for the formation of disease, the sthana samshraya or the dosha dosha samurjana, amalgamation of the vikruta doshas and susceptible tissues is mandatory for the manifestation of any disease, including our Amavata. Okay, so I think the things I have made it clear. Like Samavata is only a condition where Ama is associated with Vata. It looks like a horribly painful condition. It also looks like a systemic condition, but with small measures, it can be handled. But Amavata, according to the stage, it will require different type of manipulation and also the intervention because the disease has reached the association of Ama and Vata is graduated, reached the tissues, reached the organs, has become a multiple system disease. The approaches will be totally different. Rupas. So there are so many lakshanas in the text, but I would love to see these three. I call them as three S's. Whenever there is Amavata, I would like to call this as Pratyatma Lakshanas of Amavata. Three S's. What are they? Shota, Shula, Stabdata. Very easy to remember. Shota, Shula, Stabdata. The swelling, the pain, the stiffness or the catch. So if these three are there, the disease graduates to be called as Amavata. We need to see its backdrop. So from where it is taken, the origin, the systemic, the other systemic involvement, the other symptoms mentioned in the text. But when we come to Pratyatma Lakshana, to diagnose it as Amavata, look for three S's everywhere: Shota, Shula, Stabdata. Two or three, everything is present. Then go ahead with more questions and come to the diagnosis of Amavata. So Samanya Amavata Lakshanas we know: Angamarda, Aruchi, Trishna, Alasya, Gaurava, and Jwara. Apakaha Shunata Anganam Amavatasya Lakshanam. Very simple symptoms. You can see right there in the top, heading itself I have mentioned as gut level symptoms. Gut level symptoms. Here, though there are Shunata Anganam, though here Shunata has been mentioned. There is no painful condition. There is swelling here. There is fever, so there is a heaviness of the body, there is a thirst, okay, and there is a sort of pain, Angamarda, so like Mardanavat Vedana, so like as if somebody has hit you, some vague pains and also unexplainable pains you have. So this will be the earlier manifestations of a systemic disease. The disease has not yet reached the systemic level, though it is, we can consider this as Samanya Lakshanas, but still in my clinical practice, I have considered these things. Whenever I find 4, 5, 3, 4, 5 symptoms of these things, I will just diagnose it as Amavata initial conditions. Or earlier also I said they can be considered as Pururupas of Amavata, or we need to differentiate this particular condition with Samavata. These symptoms and Samavata symptoms together may be present in the Pururupa of Amavata. Still, the disease is much, much, much under our control. We can still treat this in an effective way if these symptoms are manifested. And then when these symptoms come, so I have mentioned them as Pravruta Amavata Lakshanas, like widespread symptoms. We can call it a systemic disease. Here, the disease has spread to the systemic level. So here the bones, the joints, the soft tissues, the organs, the tissues, everything has been contaminated by the deadly combination of Ama and Vata. So the first line itself indicates Sa Kashtaha Sarvaroganam Yada Prakupito Bhavet. When these two doshas aggravate, Yada Prakupito Bhavet, and when the Samprapti becomes worsened, the disease becomes worst among all the diseases. Sa Kashtaha Sarvaroganam. Hasta, the Shiro Gulfa, Trikajanu, Sandeshu. You can notice where the painful conditions are there. Hasta, Pad, Shira, Gulfa, Trikajanu, Uru Sandeshu. Karoti, Sarujam Shotam, Yatra Doshaha, Prapadite. Very important, three S's. Kindly remember always. Okay, karoti sarujam shotam yatra dosha prapadyate. Wherever the doshas reach, what doshas here? Ama and vata. Wherever this ama and vata, this combination is reaching, karoti sarujam shotam. Yatra dosha prapadyate. Yatra dosha prapadyate. Wherever they reach, it is causing painful condition. Sadeshaha ruchitottartam vyavidaha eva vrishchikaihi. So the person can feel as if they, that particular area where ama and vata are located to be stung by a scorpion stung pain. But we cannot ask. So I've seen so many Ayurvedic doctors or students ask the patients once they come with the painful conditions, do you have a pain similar to a scorpion sting? How would the patient explain? Because many of them don't have the experience of getting stung by a scorpion, isn't it? So it is only the simile which has been given here. So what the pain appear like? It's as worst as the sting of a scorpion is what the author tries to tell us. Janayet so Agni Dorbalyam. See the systemic symptoms here: Agni Dorbalya, Praseka, Aruchi, Gaurava, Utsaha Hani, Vairasya. So many symptoms. Bahumutrata, Kukshav Katunitam Shulam, Nidra Viparayam. It also goes to the level of disturbing the sleep. Yes, it's a painful condition. And yeah, so we can find that reference in Madhav Nidana. So I'll come to the keywords there. Kashtancha Anyan Upadravan. So it also causes Kashtancha Anyan Upadravan. Madhavakara tells that I have explained so many symptoms, but it can also produce Kashtancha Anyan Upadravan. Whatever I have not explained, beyond this also many symptoms can be manifested in Amavata. So there is no what we can call it as limitations or the descriptive margin of the symptomatology. So according to the doshas, also the symptoms are manifested when there is pitta associated with amavata, daha is more, and when vata is associated in amavata, the shula is more, and when kapha is associated with amavata, there is timita, gurutva, and kandu. All these symptoms will be manifested. Upashaya, we can see sneha dehi vruddhim apnoti. So when sneha is used, when internal or external application of sneha. Sneha, we know, sarpir majja vasatenam. Here mainly we are speaking about oil and ghee. When they are internally taken, if the patient is having amavata, so if the patient is given too much of sneha, okay, so or if the massage or any external manipulations are done with only sneha, so then the conditions will aggravate because the sneha and ama and kapha are having similar properties. There is a chance that the symptoms aggravate. And then surya megodaya nishi vruddhim apnoti. So the symptoms also gets aggravated very early in the morning during the sunrise and also during the cloudy climate and also at the night. Katuruksha Abhilasha. So opposite. So there will be always the wish to take the things which pacify the symptoms like Katu Ruksha Abhilasha. The person feels to take more and more of Katu Rasadravayukta Ahara or something, and Ruksha. So something which causes dryness. So and then coming to the Upashaya, signs of Niramavata should be appreciated here. Niramavata. So already we have discussed about Ama and Sama. So when Ama is not there, whatever is there, it is Niramavata. Okay, so here the opposite signs will be found as those of Sama. So whatever Sama Vata lakshanas are there, the opposite symptoms will be found in this particular condition. Viparita gunehi shantihi. So get specified by antagonistic qualities like snigdha, ushna, etc. So when there is painful condition or when there are ramavata like symptoms, and when you apply what the snigdha, ushna, and all those things, you need to look at the upashaya and anupashaya aspect in that particular disease. Viparita gunehi shantim. So get specified by antagonistic qualities like snigdha, ushna, etc. Samprapti of amavata. So there is a big shloka. So let's skip this. So we'll see what happens in the Samprapti. The ama driven by Vata. So already we have seen ama and Vata are the key components of the disease. So the ama, which is driven by Vata, it will reach the Kaphasthanas. Very importantly, they reach the Kaphasthana, and the ama severely contaminated by Vata reaches the Dhamanis. From there, it reaches the Dhamanis. The ama again gets afflicted by the doshas. So here ama is there, vata is there. The other doshas are pitta and kapha. So they also join the story and also worsen the condition, and they cause Sroto Abhishandi from here, and then obtains Nana Varnata. Nana Varnata is a word used for different sorts of manifestation here due to affliction by Tridoshas and mainly due to the Picchalata. So this is the root source of all the diseases and is hence called as Ama. So which is Ati Daruna, so very severe. So Ama is, or conditions associated with ama are very daruna. So both getting vitiated enter the Trikasandhi. Trikasandhi Praveshakao. So ultimately they will reach the Trikasandhi. Trikasandhi is a representative of multiple joints. So here what we can call it as bigger joints, or the places where two or three structures meet. Sandhi is not essentially a structure where bones meet. It may be the structure. It may be the junction of the meeting place, or the junction of two to three structures. So the joint places, or wherever there is what we can call it as so junctional areas of different components of the body, structural components of the body, they are the target areas for this particular ama vata. Trikasandhi, generally it has been grossly mentioned as the sacral joint or the pelvic region. So later we can find that Amavata is more than sacral or the what we can call it as the pelvic area. So it can be manifested at the various joint levels. It causes angastabdata and is hence called as Amavata. Stabdam chakrute gatram. So he tells at the last. As we are discussing Amavata, we also will just touch upon the Samavata. Already I have mentioned Samavata is a condition where Ama and Vata are associated. It is a systemic, it looks like a systemic disorder, it looks like a severe condition, but it is not as severe as Amavata, because in Amavata there is Sthana Samshaya and Dosha Dosha Samurchana. In Samavata it isn't. Vayu Samo, Vibanda Agnisada, Tandra Antrakujanehi, Vedana Shofa Nistodehi, Kramasho Angani Pidayan. Here also there is Vedana, Shofa, Nistoda, Kramasho Angani Pidayan. So we can see similar symptoms of Amavata being explained in Amavata also, but we need to differentiate them for the purpose of diagnosis. So Niramavata will be having the opposite symptoms of Samavata. So like Vishadata, Rukshata, Nirvibandha, Alpavedana and Viparita Gunahi Shantim. So it gets specified due to opposite qualities. Already we have discussed this in Upashaya and Upashaya. So Niramavata gets specified with opposite qualities like Snigdha and Ushna, and Amavata or Samavata gets aggravated when Snigdha or Sneha Dravyas are used. So already we have discussed about the differences between Samavata and Amavata. So the coming to the treatment principles: Langanam Svedanam Tikta Deepanani Katonicha Virechanam Snehapanam Vastayascha Amamartha. A very famous slogan. We already know these things. So from Ashtanga Sangraha we can see another reference where it is said Pachanaihi, Deepanaihi, Snehaihi, Tan Svedaihi cha Parishkrutan Shodayet Shodanaihi Kale Shodayet Shodanaihi Kale Yatha Sannam Yatha Balam. So when Ashtanga Sangrahakara tells Yatha Balam, so here it tells that the bala of the person is compromised in this particular condition, and you need to choose the line of treatment according to the bala of the patient and not according to the principles. The principles are mentioned. Even you can see the Bhava Prakasha quotation: Langanam, Svedanam, Tikta Deepanani, Katunicha, Virechanam, Snehapanascha, Vastayascha, Amavarate. Do we use all these treatment principles at a time? No. Do we require all these treatments for the patient of Amavata? No. At different conditions, at different stages, and with the different range of aggravation of Ama and Vata, and also seeing the association of Pitta and Kapha, seeing the dhatus involved, seeing the organs involved, our treatment principles goes on changing. So it is only the principles which the authors have given. It is our yukti to use them wherever or as and when needed. So that is the basic thing. So that was the introduction part. So coming to the presentation part, second to the presentation, how Amavata is presented and how we can. So from here the story becomes a little bit interesting. So towards the diagnostic tools and also the treatments. So I have covered this particular section. So that is section, the presentation section, in, under 5 different headings. So from diagnosis and treatment from Nidana Panchaka perspective, diagnosis and treatment from Kriyakala perspective, from the perspective of involvement of Srotas, Dhatus and also the organs, and also from the Shleshmasthana, Shleshmasthanam Pradavati. Shleshmasthana is very important for us in Amavata from the perspective of Shleshmasthana and depending on the location of Ama according to Vagbhata. So coming to the part 1, diagnosis and treatment principles from Nidana Panchaka perspective. So already we have discussed the Nidana Panchaka. So in brief, so the history of food intake and what is the lifestyle of the patient. It is very important to note down in the case format. Whenever you are taking the case history, it is important to make a note of the history of food intake as well as the lifestyle practices. It is very important. So Nidana Parivarjana is very important for us. So we need to make a note of these things. This becomes an important diagnostic tool. Okay, so if symptoms of Amavata are present along with one or more Nidanas, so our job in the treatment is to isolate the Nidanas along with the treatment, isn't it? So, but don't forget to look at triple S or three S's everywhere. Shota, Shula, Stabdata. If these three things are there, and if the lifestyle and also the food intake are erratic in the patient, and you find more symptoms involving the systemic involvement or the gut level involvement, you can decide the stage of the Amavata and start your treatment accordingly. Now, what are the key strategies looking at Nidana? The key strategies will be Nidana Parivarjana, isn't it? So Nidana Parivarjana is very important intervention at this particular stage. And if symptoms are there, like Shota, Shula, Stabdata, assess the range of those complaints and give Amavata Chikitsa, which has been explained in our text, according to the condition and according to the strength of the symptoms. So coming to the Purva Rupa, so the symptoms already I have mentioned, the symptoms will be similar to Samavata or the Samanya Amavata Lakshanas manifested in a feeble form. So the symptoms are itself the diagnostic tools here. Catch hold of the symptoms, see the range, try grading them. We do that at the research level, at the PG and PhD levels. Students can start grading the lakshanas, like pain. What is the range of pain? Like I ask my patient, so on a 1 to 10 scale, where is your pain? So I tell 10 is the worst, 1 is the least, and if you tell 0, there is no pain. So for every complaint, you can have your own scale. Like I have my 1 to 10 scale. Okay, it is very easy. So when the patient tells 5, it is 50%. So like the severity is 50%. This also helps you in analyzing the results of the treatment. When you're asking, okay, after 2 months, 1 on 10 scale, where is your pain? The patient would have said at 9 previously. After giving the treatment, he or she would now tell, it is there around 5 and 6. That shows the range of improvement and the effect of your treatment. So we can use these strategies here. So the key strategies in treating the Purva Rupa will be Tikta, Katudipana, and Pachana. That is whatever has been explained in the Vata line of treatment. Vatanulomana, Langana, Svedana. And if the symptoms are really stronger and worse, even in the Purva Rupa condition, so you can try a course of Virichana. So following Dhanyamlatara or Valupasveda done before that. So initially see that you do some external measures. External measures are very important. I'll just touch upon that later. So after doing Amapachana and also Dhanyamlatara and Valupasveda, the external measures, after analyzing that Ama has been controlled to a particular extent or to a sufficient extent, when you're satisfied, you can go with Virechana and flush off the toxins or flush off the Ama and Vata and see that you can give better results. Rupat. So coming to the diagnostic and treatment approach from the Rupa perspective, if Samanya Lakshanas are there, it is very easy for you. So the classical symptoms are there. Definitely your diagnosis is on and you'll go to the treatment of Amavata itself. So for Samanya Lakshanas, treat as in Purva Rupa. So Langana, Svedana and Deepana will be the key strategies when Samanya Lakshanas, which Angamarda, Aruchi, Trishna, Alasyam, Gauram, Jaraha, Apakaha, Shunata, Anganam, Amavata, Lakshanam. When these symptoms are there, just treat it with Langana, Svedana, Deepana. If possible, include some external measures and your job will be done. When the symptoms are more worst, Pravruddha Amavata, so when the disease is established, it is a multi-system disease. It has become a multi-system disease. You can go for higher treatments like Virechana, Vasti, and Snehapana. So whatever has been explained in the Chikitsa Sutra or the treatment principles, you can divide them, or you can segregate them, or you can take them according to your yukti, make some small formats of the treatment and treat accordingly. As I said, for Samanya Lakshanas, if systemic symptoms are not too many, Langana, Svedana, and Deepana will be okay. But if there are more worse conditions like multi-system involvement, multi-joint involvement, painful conditions, Stabdata, Guruta, Shula, all these are there and the patient is not able to tolerate, have a violent approach. For the violent disease, have a violent approach. And again, don't fail to use Yukti and also the Dashavida Pariksha Vidhi and all sorts of analysis of the strength of Atura and Vyadhi. This is very important. The Bala of the Vyadhi and the Bala of the Atura should be analyzed before selecting the mode of treatment, like whether you're going to go with a smoother version of treatment or moderate version of treatment or with a severe version of treatment. You need to see the Bala of these particular conditions. If the disease is worst, you can go with Virechana, Vasti, and Snehapana. That is how we segregate the Chikitsa principles. So according to the Sthanika doshas, if you find the symptoms are Vata Pradhana, you can go with Virechana and Vasti. If it is Pitta Pradhana, you can go with Virechana. And of course, if it is Kapha Pradhana, you can go with Vamana and Virechana. Don't forget 3 S's, and also don't forget the external treatments. So Master Harita has mentioned some Rupa. Since we are discussing the diagnosis and treatment according to the Rupa, Master Harita has mentioned some Lakshanas according to Harita. So I will just avoid reading the sloka and I'll just come to this brief synopsis of what Harita has said. So there will be Bahuvedana, there will be Amatisara. Ama is moving in the downward direction here in the form of Atisara. And there is Sandishofa, Jaratvam Gatranam. So there is a weakening of the body parts. Balasa Patanam Mukhe. There is excessive expectoration or phlegm coming out through the mouth. And Prushta Manya Trikavedana and Anga Vaikalya, physical deformities. Those people who compare Amavata with strictly with rheumatoid arthritis, yes, or gouty arthritis, the complications where you can see the deformities there, we will be very pleased to see the Harita's explanation of Anga Vaikalyata being mentioned here. Okay, and even Madhava Nidana also we can see Sakasta, Sarvaroganam, and we can see the multi system involvement there. So Kashtas Anyan Upadravan, at last Madhavakara also tells. So deformities are explained in the explanation of Amavata. That is why it compels most of the Vaidyas to compare these particular conditions to rheumatoid arthritis or a gouty arthritis or whatever condition. So Rupa, so still being in the Rupa itself, according to the Harita, so he classifies the symptoms or Amavata into 5 types. So those who have gone through Harita, you'll be knowing this, or else, so this is a very important perspective. So my diagnostic principles and also my treatment approach changed after reading Harita. I've started analyzing these conditions also in my patients. So the first condition of Amavata is called as Vishtambiyama, and this in this condition you can see 3 conditions: Sharira Guruta, Admana, Vastishula. How to diagnose these people? Very simple. The person comes with heaviness of the body, not being uh, relieved by anything. There is Admana and there is pain in the lower part of the abdomen. Simply you can diagnose it as, if the patient has tried everything, your simple job is to diagnose it as Amavata, especially Amavata dash Vishtambiyama according to Harita. If you are more precise, you can note down in your case performer and what are the treatment measures you are going to give. He has said Pasapi Pachanam Karyam Sneham Chaiva Karayet. So Pachana and Snehana are the important measures here. So related to this Harita's Rupa Vishtambiyama, I have a case in my clinical practice which I had dealt a few years ago. So it was a 30 years old female. The person had regular bloating and distension of abdomen. I will not miss the complaints here. I'll just read out the case for you. So 30 years old female, regular bloating and distension of abdomen. See the Admana mentioned by Harita. heaviness in the region of the bladder and pain during urination. There was frequency of urination. There was stiffness of the body as per the patient. The patient said there is stiffness of the body. So pain in the lower joints, that Harita has not explained, but I found that pain in the lower joints in the patient. There was constipation, there was lethargy and pain during menstruation. So the USG of abdominopelvis and also the test for RA, gout, all those things seem to be normal. And the patient was also diagnosed with DM, diabetes mellitus, 6 months back, and was on the modern treatment for diabetes mellitus. So I treated this particular condition on the lines of Amavata, especially Haritokta, Vishtambi, Ama, Lakshanas, and it gave me good results. So what I did was I put her on Panchakola Siddha Jala. So what our Harita tells, Pachana and Snehana. I used Pachana and Snehana principles here. I put her on Panchakola Siddha Jala, Ajamoda Adi Churna, not all at once. So because in different schedules, I gave these medications. Panchakola Siddha Jala, I asked her to drink instead of plain water for a few days. Don't drink water at all, only just drink Panchakola Siddha Jala. You can practice this in Amavata. In a classically diagnosed Amavata, try. If there is more Ama than Vata, you can give Panchakola Siddha Jala and ask the patient to drink this water without normal water. Whenever you feel thirsty, because Trishna is also a symptom of Amavata. Whenever you feel thirsty, you don't drink plain water, you have to drink Panchakola Siddha Jala. Very simple. Okay, so Ajamodadi Churna, Simmanada Gugulu, classical medicines for Amavata, I prescribed here. Avagaha with Dashamula Kvata. Avagaha with Avagaha Sweda with Dashamula Kvata. That's all. The symptoms reduced in 15 days. Later, I put her on Virechana, so like Gandharvastadi Kashayam and also the Taila for 1 more week after those 15 days. And finally, after most of her symptoms were relieved, I put her on Vastyamayanthaka Gruta for 1 month. So you can find Vastyamayanthaka Gruta prepared from many pharmacies. You can go through those ingredients. It's a wonderful Gruta. Okay, so it can be given in the bladder and urine related cases after analyzing that particular case. So here, Vastyamayanthaka Gruta is not directly indicated for Amavata or this particular condition. I used my Yukti and gave this particular medicine because I wanted some Sneha to be given after Virechana, after break after Virechana. So I thought I'll put her on this. So I keep experimenting in my clinical practice, and this gave good results. So coming to the second type of Amavata explained by Harita, Gulmi Amavata. So here Amavata, Gulmi. So we know about a different disease called as Gulma. So here the abdominal complaints are predominant along with the Amavata complaints or the Ama complaints. You can see the Jatara Garjana here, gurgling sounds in the abdomen. Gulmavat Paripedyate, pain as if the person is having Gulma. Whatever pain is in Gulma. We know the sthanas of Gulma, isn't it? Parsva, Brunna, Abhivastayaha. In all those areas, there will be pain in Gulmi, Amavata also. But we will not be diagnosing that particular condition as Gulma. Kati Deshe Jadatvam. We need to differentiate Gulma from Gulmi, Amavata. Kati Deshe Jadatvam. Stiffness in the pelvic region. So the treatment principles will be Langhana here, very important. Okay, so the Langana we know is one of the best treatments for Ama and also Amavata. And then Pachanam Naiva Kartavyam, he tells, do the Langana, but never give Pachana. Never give Pachana. So Ama digesting measures or Ama treating medicines should not be given in where? In Gulmi Ama, in this particular condition. Okay, so because the condition regresses immediately after the Gulma gets digested, there is some Gulma type Samprapti taking place in the body. Once it comes down, the disease will settle down. We need not give Pachana. If Pachana is given in this condition, it will cause immediate death or complications, is what Harita tells. So this is a condition which needs to be differentiated from Gulma. I haven't got these conditions to see in my clinical practice, but just for the description and also for to share the knowledge, I am just giving these points. So comes the third one as Snehi Ama. So its symptoms are Gatra Snigdata, oiliness of the body or unctuousness. The person feels that the entire body is oily. Sometimes it is seen that after Snehapana we can see some Snigdha Gatrata. Similar thing can be seen in these patients without taking Sneha also. Some people complain that the skin is sticky, so they need to take bath every now and then. So that is called as Gatra Snigdata or oiliness of the body. So Jadya, stiffness of the body parts, or Jadya also can be the immobility. There will be Mandagni and Snigdha Vichala Ama. So excretion of what? Ama. Snigdha Vijala Ama. So Vijala. So the Ama is excreted from the lower part of the body, but through the defecation, but it will be oily but devoid of watery content. So it will be more oily, less watery. The stools are more. So the body is oily. There is the stiffness of the body parts or the immobility, and there is Mandagni, of course, as an Amavata, and then we have Snigdha Ama being eliminated out of the body, but the Ama has more Snehamsha, but it is having less of watery components. So what are the treatment? Na snehanam karyam. So here also snehana need not be given because already the body is snigdha, and the ama which has been being eliminated in small quantities is also having snigdhata. No need of giving snehana here. Na snehanam karyam. Upavasam cha karyayet. So here upavasa rupa langana. We know dashavida langana. So here upavasa rupa langana should be given in this particular patient. Pachana should be given. Ama digesting medicines or ama pachana medicines should be adopted here. Previously in the gulmi ama we have seen pachana should not be given. In this particular condition, pachana should be given. Amam cha eva atisare. So excessive ama in the body should be purged out of the body. It should be eliminated out of the body by giving the treatments which flush out the ama from the body. So there is a related case with this particular condition. As I said, I use Harita principles of Amavata also for clinical diagnosis. So once again, you can see the conditions here: Gatra Snigdha, Jadya, Mandagni, and Snigdha Vijala Ama. I'll come back to this condition. Not many. So this condition resembled like Haritokta Snehi Ama. So a 35 years old woman diagnosed with rheumatoid arthritis. Already the patient was diagnosed with rheumatoid arthritis. So pain in the hand and foot since 5 months. The body has become unusually oily. Even others used to tell her that she is looking attractive. She is looking what? So like the appearance of the patient itself changed. Everybody could appreciate. So this because of the skin being unusually oily. Some people will have dry body parts. When there is a change, people will definitely notice that. So there was indigestion and aversion towards food. So early morning stiffness and rigidity. I have given 3 plus there. There was a severity. So like out of 5, I have graded 3. Morning stiffness and joint rigidity. So she was crippling a bit. She had observed oily, smooth stools, but no diarrhea. Very important. So she used to tell that there is some oily stools going every now and then, not regularly, but it was not diarrhea. So it was not watery stools. Vijala. Okay. Tests for RA were positive. She was put on NSAID, which she couldn't tolerate. So pain reduced, but other complaints were bothering her. So what was the treatment I prescribed was she was put on Dhanyamla Dhara for 5 days. So no need of telling much about Dhanyamla Dhara for our South Indian students and also South Indian clients. We have seen a lot of Dhanyamla Dhara being used in the treatment of Amavata. So it's not only an external measure, it also helps like a what we can call it as Amapachana measure. So after Dhanyamla Dhara course is done for 2, 3, 4, 5 days, you can see the patients without doing anything else. We can see the patient's appetite improves, the complaints come down, the painful, the stiffness comes down. So you can find relief in 3 S's. I have seen this in many conditions after course of Dhanyamla Dhara. Definitely there is improvement. We can see that the external treatments have an internal impact also. So Panchakola Siddha Peya, Yusha, Lagu Anna. So I wanted to put her on light diet. Just as in Samsajan Krama, I put her on Panchakola Siddha Peya, Yusha, and Lagu Anna. And I put her on Amavatari Kashayam mixed water. So previously I had used Panchakola Siddha Jala in the previous patient in the related case previously we discussed. Here I used Amavata Kashayam mixed with water instead of water. I asked the patient to take uh, the water mixed with Amavatari Kashaya instead of plain water. Okay, so I could have used Panchakola Siddha Jala also here, but since I had used Panchakola for Peya, Yusha, and Lagwanna, I did not want to overdose Panchakola. So, because it may become intolerant, Panchakola may become intolerant if it is used in larger dosages. So fasting for one third day. So I asked her to fast almost for one third day. So because she could stay without food for half a day also, she had that capacity. I asked her just fast for one third day. So whenever we are telling the upavasa, whenever we are telling the langana, we also should calculate what quantity of upavasa we should be prescribing to the patient. We should see the tolerance. So and Amrutottara Kashaya. So later, Simanada Gugulu and Kashaya prepared using Guduchi, Trifala, and Haritaki. Okay. So instead of Amavatari Kashayam, after 2 weeks, first initially Amavatari Kashaya, Siddha Jala, so I had given to the patient, and later Amrutottara Kashayam was given, and later, so since the condition was more severe in this particular patient, I put her on Simanada Gugulu and then Kashaya prepared with what? Three things: Uduchi, Trifala, and Haritaki. So I used this instead of Amrutottara Kashayam after 2 weeks. 2 weeks I used Amrutottara Kashayam, and later I shifted on to Guduchi, Trifala, and Haritaki Siddha Kashaya. So stronger purge was not preferred. So because I did not have any intention of giving a classical virechana in this particular patient, seeing the bala, the patient had avara bala, and I had to deal according to that particular perspective. May I kindly know if I'm audible? May I kindly know if I'm audible from the organizers?
Yes, sir, you are audible, sir. No issues, sir.
Okay, no interruptions, right?
No, sir, no, sir.
Thank you so much. So again, a related case. So the related case, the results. We'll come to the results of this particular same case. She recovered from her complaints in 1.5 months' time. It took a long time. I need to see through the severity of the symptoms. At the same time, the bala of the patient was avara, as I said, and then after 1.5 months, her complaints were almost relieved. So it was a challenge because she could not tolerate NSAID, and I couldn't ask her to continue those things. The pain was very severe, the complaints were severe. I need to manage the things. Okay, so especially because she did not tolerate NSAID, though she was pushed by her family members to take at least some painkillers, she said she couldn't tolerate. And as we say, Chikitsa Chatushpada is very important. We need the cooperation of the patient as well, and the patient cooperated really well in spite of having avarabala. Probably she was mentally a little bit strong, and we had to manage with simple yet effective formulations. As I said, I did not have any intention of giving a Tikshna Virechana in this particular case. In this particular case, I am thankful to Master Haritha. So his principles came handy, and it was really helpful for me to handle this particular case. So even after recovery, she was not able to tolerate sneha. Please note down this. Even after recovery from the symptoms, the patient was not able to tolerate sneha, even when small quantities were given along with the food. I asked her to avoid sneha for a few days, and after 1 month, she was given a course of vasti. So this is very, very important in chronic and complicated Amavata conditions. So try vasti, very important treatment, but you need to just judge when it needs to be given and when not. Okay, so the famous combination of Saindavadi Tailam for Anvasanavasti and Erandamuladi Vasti for Asthapravasti. So that alternate courses I have given to this particular patient, and substantial relief was found later. So she got well in 3 months' time, and she was able to attend her work also. So snigdhata reduced, the pain reduced, stiffness, everything was reduced. The biological values also came to almost normal. So she came back with similar complaints without oiliness of skin 1 year later. After this treatment, 1 year later, again the patient contacted me for similar complaints. The complaints were not in a horrible way. She could tolerate it, but there was no oiliness. She was very pleased with that. And she was once again treatment on the same lines. I made some small variations in the treatment and gave her a short course of treatment. Again, Vasti was given and the patient sent. So following that, I lost the contact of the patient. So as far as I have seen this patient for one follow after the things were managed really well, complaints were reduced, and she was really doing good. So coming to the fourth condition explained by Harita, so that is according to the Rupa, Pakwa Ama. So here we can see what are the symptoms. Pita Vijala Shava Pakwa Ama Patte Adhat. Okay, Ama is going in the downward direction. Ama is being excreted through the anal route. Ama is flushed out of the body. What type of Ama? Pita, Vijala. Again, there is no water in the Ama. There is Pita. So how we should know that it is Ama? We have to go to the properties of Ama. Avipakam, Asamyuktam, Durgandham. All those qualities will be there. You will obviously know that it is Ama. And Pakwa Ama. It looks like well formed. So along with stools, this will be excreted. Na vasti shulaha. Here we will have absence of the pain in the lower abdomen or the urinary bladder region. Shrama, of course, there will be Shrama and Klama. Treatment principles: Na kuryat tasya pachanam. Harita was very specific to tell Na kuryat. So in most of the treatment principles, we will see kuryat, what need to be done. In Harita's treatment principles, here and there we can see Na kuryats also. Na kuryat tasya pachanam. He tells no need of giving Ama pachana medicine here. Okay, so then he tells Virechanam na kartavyam. Virechana should not be given this particular person because already Ama is being flushed out in the lower direction. So no need of giving Virechana. Okay. Stambanam tasya karayet. So it should be treated on the lines of Atisara. So it's a Stambana Chikitsa should be given in this particular condition. I have not come across any case in my clinical practice where I could diagnose a condition as Pakwa Ama according to Harita. So, but it is a topic or the symptoms to be pondered upon in our clinical practice. So the last one is Sarvanga Ama. Sarvanga Ama. So Harita tells Kati Prushte Vaksho Deshe Todanam. So there is Toda, there is pricking pain or the throbbing pain in where? Prushta, that is back and low back, Vaksha, chest, and so Kati Prushte Vaksha. So Prushta is the entire back, Kati is the lower portion of the back, what we can call it as the pelvic area, and also the Vaksha, the chest region. In all these regions there will be pain. Vastishula. Again, he comes. You can see through the Harita's explanation, Vasti and Vastishula are specifically mentioned. So this becomes a very important diagnostic tool or the criteria for us to look into in Amavata, or we can consider it in another way. In Amavata conditions, the involvement of Vasti will take place invariably in many patients. And if there is lower abdominal discomfort, or if there is pain or discomfort in the bladder region, or if some urinary complaints are associated with the 3S's, of course, and other symptoms, we can consider that as one of the variants of Amavata explained according to Harita. Okay, so Gulmato Jataram Garjate. So there is gurgling sounds in the abdomen as similar to that seen in Gulma. So Harita is trying to correlate Gulma, not correlate, associate Gulma, Amavata, and Vasti. We can see this being repeated here and there. So have them as key important areas, and also have the key areas for Amavata as Parshvarunavi Vastayaha. The pain need not be in the joints. The pain can and discomfort can be in these conditions. If you give Gulma Chikitsa and Gulma Chikitsa is not successful, immediately switch on over to the Amavata Chikitsa. And then coming to, so the symptoms already we have seen. So Shofa, Shirogurutvam, Amascha, Patati. So these are also the symptoms continued. Shofa is there, Shirogurutvam, Amascha, Patati. There is excretion of Ama. Excretion of Ama has also been mentioned by Harita in 3 of his variants. We need to see that very importantly. So what are the conditions of Sarvanga Ama? Kati, Prushte, Vaksho, Deshe, Todanam, Vastishula, Gulmato, Jatare Karjate, Shofa, Shirogurutvam, heaviness in the head, and Amascha Patati, excretion of Ama. What are the treatments? Pachana and Virechana. So those are the 5 variants of Harita. I think so that was useful to everybody. So coming to the Sthanika Lakshanas, we need to see the Lakshanas. Please remember, we are discussing the diagnostic tools of Amavata and also the treatment principles from the Rupa perspective here. Okay, so Nidana Panchaka in that Rupa perspective. So Sthanika Lakshanas are Sandishola, Sandhi, Shota, Gatra Stabdata, Staimitya, Daha, Raga, Kandu, Daha and Raga. So there is a typo mistake there. So it is not Raha, it is Raga. So it is the redness. These belong to the Pitta involvement in Amavata. So Kandu and Staimitya again indicate the Vata involvement in Amavata. These Sthanika Lakshanas should be seen. Whenever you are analyzing a joint from Ayurveda perspective, you see for Shula, 3 S's I have mentioned previously. Shula, Shota, Stabdata, Staimitya, Daha, Raga, Kandu. If you can get most of the symptoms, go on grading them, and your diagnosis of Amavata or not non-Amavata rheumatological conditions will be there on your paper. And coming to the Sharirika Lakshanas, apart from these Sthanika Lakshanas, whatever Lakshanas have been mentioned by Harita and also the Madhavakara in the Pravruddha Amavata Lakshanas and also in the 5 types of Amavata will be considered, apart from these symptoms, will be considered as Sharirika Lakshanas. You can see, you can go through those slokas again and see Angamarda, Aruchi, Trishna, all these things, Praseka, Asevarasa, all these things were mentioned in Pravruddha Amavata Lakshana, isn't it? Kukshi Katinata, Prudgraha, Jadya, all these symptoms. Manasika Lakshanas, we also need to see the involvement of mind and senses in every disease. Alasya, Brahma, Murcha, Utsaha, Hani, and Nitra Viparyaya, or the extracts from the classical description of Amavata Lakshanas, which fit into Manasika Lakshanas. So another means of a quick diagnosis is to classify the overall symptoms of Amavata into what? Pratyatma Lakshanas, already I said 3 S's, Shula, Shota, Stabdata. Shula, Shota, Stabdata. Sandhi Shula, Sandhi Shota, Sandhi Stabdata. Or Gatra Shula, Gatra Shota, Gatra Stabdata. Anything. And Samanya Lakshanas. One is Pratyatma Lakshanas, compulsory, 2 or more than 2. Samanya Lakshanas, all other signs and symptoms which we just discussed before comes under Samanya Lakshanas. Yes, Upashaya and Upashaya, as already I said in the intro part itself, it is very important to analyze what is causing the aggravation of the symptoms, what is causing the pacification of the symptoms. They also will help you in the treatment aspects. Okay, so when Upashaya clicks, it becomes your Chikitsa. When Upashaya worsens the condition, it becomes Anupashaya. Then you will go to other line of treatment, that is plan B, plan C. So this is how Upashaya and Anupashaya works. If Upashaya really works for you, if you have done an experimentation on the patient, and if, as I have done, seeing the Haritas Lakshanas, if things work for you, you can just continue them. Your Upashaya will gradually graduate into Chikitsa. Samprapti and Samprapti Vigatana, yes, very important. For Samprapti Vigatana, again, we need to go to the Ashraya of the Kriya Kala, Shad Kriya Kala. Already we have touched upon this particular point, how to see the different aspects of the disease in different stages. So Kriya Kalas, the involvement of Dosha, Dhatu, Srotas, Bala, Vyadi, every component you need to analyze in the Samprapti of Amavata. Don't forget the 3 S's, the Bala of the Vyadi and the Bala of the Vyadhita. Along with that, follow the Kriya Kala, see where, in which stage it is there. It is in Pura Rupa, Rupa or Bhedavastha, or in Sanchayavastha, at the gut level, or aggravated at the gut level, or it is traveling to the different parts of the body, like in Prasara. What is the status of Agni? How many Srotas are involved? Go on listing them, and your treatment will become more easy. So coming to the part 2, the diagnosis and treatment principles from Kriya Kala perspective. Till now we have discussed about from the Nidana Panchaka perspective. We will go to the Kriya Kala perspective. So Sanchaya, as I said, Sanchaya is the doshas will accumulate in their own places. In Amavata also, the disease Samprapti or the Ama and Vata combination will, since Ama is formed in the stomach, it will be at the gut level itself. It will be in its region itself. So feeble symptoms. So if you find Ama symptoms at the gut level, some discomfort and all, you can consider it as Sanchaya, and your treatment should be Deepana and Lagu Ahara mainly. You can also treat this condition on the lines of Ajirana, Agnimandya, and Arochaka Chikitsa because when Amavata is in its budding stage, in the stage of Sanchaya, when the doshas are still accumulating in their own places, it will look like Ajirana or Agnimandya or Arochaka. It will have the symptoms of these things along with the symptoms of Ama. If 3Ss are in milder proportions, go ahead and treat with Deepana and Laguahara. So when Prakopa, the same complaints will become more in the stomach or in the accumulated places. So Ama will get the Vidagdavastha being associated with Vata in this particular condition. I'm taking this from the Samprapti mentioned in Amavata. So this Vidagda Ama is Ama getting associated with Vata. Okay. So when Ama gets Vidagdha by Vata, so it will what it will do? Ama gets absorbed through rasayanis and afflict the rasa. So these are the Samprapti Gatakas, Samprapti explanation from Madhavanidana. And what happens consequently? The rasa dhatogni will come down. Ama and Kapha will further increase in its own seat. So these are the pathological events taking place during the Prakopa stage of Amavata. So we have a Samprapti in Madhavanidana, the entire Samprapti of Amavata. We can split that Samprapti for any disease. You try to split the Samprapti into Sanchaya, Prakopa, Prasara, Sthana, Samshaya. Okay. Of course, Vyakta will be given, your Sthana Samshaya will be given as Pururupas, Vyakta will be given as Lakshanas or Rupas, and your Veda Avastha will be explained with Upadravas in the text itself. The other part of the Samprapti, you can just classify, cut, make the dissection of the Samprapti and see where exactly the Samprapti is fitting into the Kriya Kala. So Samavata Lakshanas may be feebly found or the symptoms of presence of Ama. Already we have discussed about this. In Prakopa stage, Samavata Lakshanas, even in Sanchaya, Samavata Lakshanas may be feebly found, or the Samanya Lakshanas of Amavata will be found in a small proportion at the gut level. At the gut level, not at the systemic level. We need to remember Sanchaya in its sthana, Prakopa in its sthana, Prasara out of its sthana, Sthana Samshaya in the other dhatus. Okay, Vyakta in that dhatu itself, wherever there is dosha sammochana, the Veda also will take place in that place itself. Okay, so we need to remember these things. The treatment will be almost like Sanchaya, but you can increase the strength of the medications here. So what is the rule of Prasara? Vayuna Prerito hi Amaha Shleshmastanam Pradhavati. Okay, here we need to treat Vata very importantly in Prasara stage. Ama is also tackled. Vata should also be tackled in this particular condition. Okay, so so I have split the Samprapti again here from the Madhavanidana Samprapti. So I'll just go ahead. So yeah. So the clues can be held by ongoing Agnimandya and Ajirana. What you can see in Prasara is the symptoms are getting worsened. The symptoms which are there at the gut level are becoming a little more systemic because there is a transfer or a travel of doshas in the body. We get the clues from ongoing Agnimandya and Ajirana. So that is the Agnimandya and Ajirana are worsening from time to time, along with heaviness of the body, rising rigidity, anorexia, all those things, lethargy, klama, all those things will slowly be graduating towards the higher scales. You can identify the patient to be in Prasaravastha. Okay, Sanchaya, gut level, feeble symptoms, Prakopa, gut level, that is Samanya Amavata. When I tell gut level, go to the Samanya Amavata Lakshana or the Samavata Lakshana, feeble level, little more aggressive Prasara, little more symptoms or feeling discomfort all through the body with heaviness, rigidity, everything, 3Ss, little more increased, and ongoing or graduating Agnimandya and Ajirana catch hold of Prasara. Okay, so you can find uneasiness in the chest due to increased workload. Here, as I said, Vata also should be handled here because you look at treating the Amavata condition with Amavata set of medications while having your vision fixed on what? On Vata. Okay. So when it comes to Sthana Samshaya, where is the Sthana Samshaya? Mainly the Trikasandhi, as we see through the Samprapti of Amavata, but Shleshmasthanam Pradhavati. The combination of Ama and Vata are going to the Shleshmasthana and getting lodged there. So the entire Shleshmasthanas, if we can go to our basic of Pata Pitta Kapasthana and Shleshmasthana, the entire Shleshmasthanas should be considered to be the sthana for Ama and Amavata. Okay, why? Ama has the affinity, sorry, Shleshma has the affinity for Ama. So we have affinity, we have attraction. Being similar elements, the Kapha identifies Ama and holds it with it. So Pradhana Shleshmasthana again, though it is Ura, Amashaya, yes. And for Ama, again it is Amashaya. And in Shleshmasthana, the Shleshma has the capacity to identify the pathological element Ama. So it will catch hold of Ama. So for the disease Amavata, it has more attraction, more affinity towards the Shleshmasthanas. So Shleshma Dhara Kala is afflicted by Dosha Vidagda Ama. Here Vata Vidagda Ama. Or Ama and Vata. Shleshma Dhara Kala is primarily affected. And since this Kapha, Ama joins Kapha, the Kapha also increases along with Ama. And this Kapha and Ama together, they block Vata. Like there is an Avarna of Vata. And that Vata once again becomes more mischievous. So these are the type of pathological events happening in our body. So the diagnosis and treatment strategies should be same as the Purvarupa stage itself, because in Sthana Samshraya, the doshas are entering the dhatus and trying to get lodged there. We call it as dosha sammurchana. Vikruta dosha and durbala dhatu. There is dosha sammurchana. The difference between Sthana Samshraya and Vekta is, in Sthana Samshraya, fourth stage of Kriya Kala, the dosha sammurchana starts. It starts. That is why there is Purvarupas. In Vektavastha, the dosha sammurchana becomes strong and completes. In Sthana Samshraya, dosha sammurchana starts. In Vektavastha, dosha sammurchana completes. So when it completes, the symptoms are manifested. Symptoms of the disease are manifested. Until then, there are Purvarupas. So since Purvarupas don't require a very strong approach or treatment, unless your 3Ss are very strong and the patient is not able to tolerate, you can just go with the simple strategies as explained in Purvarupa Avastha. And in Vekta Avastha, we know the Chikitsa Sutra of Amavata itself should be used in treating the Vekta Avastha. And if there is Veda Avastha and if the disease has gone to the complication, smaller treatments will not at all come into the question. So you need to go with Virechana, Vasti, Balya, and also the Rasayana Chikitsa to prevent further progression of. So we cannot revert many changes which has happened in the disease. We can revert to an extent, not the entire extent. The damages or the complications, many things cannot be reverted. So if you cannot revert them, what as a doctor you can do is you can prevent the further progression. You can prevent the further progression of the symptoms. So coming to the part 3, so diagnosis and treatment principles from perspective of involvement of srotas and angas. Already we have seen many srotas are involved in Amavata, so it is a multi-system disorder. So srotanusara lakshanas we will see. So just I have I'll rush through these slides. Sroto anusara lakshanas, you can see what are the srotas involved. There also whether Vata is involved or Pitta is involved. So Vata, Pitta and Kapha symptoms according to the srotas in Namavata will help in diagnosis. Example, if there is more Raga than the 3Ss, it clearly indicates it is a Pitta involvement. It clearly indicates that there is a Raktava Sruto involvement. in Amavata, and the Ama and Vata Lakshanas are feeble. There is more Raga, there is more Daha. Okay, there is little bit of Jara. Simple is approach Pitta. Okay, and some Rakta Prasadakas, seeing that Raktavasrutas is involved, some Rakta Prasadakas, something to specify the Raktavasrutas and also the Raktatu, because Rakta and Pitta are having the Ashraya Shrayi Bhava, these things should be seen. If there is more Angamarda and heaviness in the chest, you can feel it is Vata which is involved, and Rasavaha and Mamsavaha Srutas are involved. So, like this, on permutations and combinations, you can see which doshas are involved in Amavata, number one, and those doshas are disturbing which srotas. I think I'm clear. Which dosha is predominant in Amavata? Ama and Vata, of course, are there. 3Ss are there. Which dosha association is more in Amavata? And that association is more in which srotas? If you can analyze, your treatment will be more easier. So I made a chart of these things. Case study. So related to this Srotas and Anga and the involvement of doshas in the Srotas and the Dhatus, I have taken a case study from my clinical experience. You can see 51 years male patient, a known case of diabetes mellitus since 10 years. I have mentioned diabetes mellitus because I have used the same words in which the diagnosis was done. I am not using the Prameha or Madhumeha here. Only my Ayurvedic description of Amavata, I am strictly adhering to the Ayurvedic principles. So these things, case presentation will be in the language of the patient and the report of the patient. So 51 years, male known case of diabetes mellitus since 10 years on medication, develops pain in multiple joints. No swelling for the past 2 months. There is pain without swelling. So the patient is having polyuria. Observe the symptoms. Polyuria, thirst, fatigue, reduced digestion, reduced concentration, that is reduced focus. Diabetes mellitus was under control because he was on the medication. The analgesics were given. The patient did not find relief of other complaints other than pain. Other than pain, okay. So did not find relief of other complaints other than pain. So since the pain in joints and polyuria were fresh complaints, are you seeing this? So since the polyuria and pain in joints were fresh complaints, I administered Ajamodadi Churna with honey, Simhanada Gugudu. See, since there is polyuria, I am not approaching the patient from Prameha, Madhumeha, or Mutra Krishna perspective. Seeing the involvement of joints along with polyuria, I am approaching the patient from the Amavata perspective. I administered Ajamodadi Churna with honey, Simhanada Gugudu with hot water, and Amrutottara Kashayam. All complaints came down in 4 to 5 months duration. Sorry, 4 to 5 days duration. You can do this. Ayurveda has wonderful treatment strategies and medications and formulations. Definitely, if Yukti is used, many symptoms can be addressed. So I asked the patient to continue the medication for 15 days, though there was relief in the complaints. Later, the patient was interested in switching over to Ayurveda for his diabetes. Okay, so the polyuria and the pain in joints came down a little bit. So the patient was satisfied within 15 days. The patient was a known case of diabetes, as I said, from 10 years and was on medication from 10 years. And the confidence which the patient got after taking the Ayurveda treatment compelled him to request his doctor, that was me in this condition, it can be any doctor, doctor, can you treat me for my diabetes? Okay, that is the confidence which we can create. I keep telling my patients and also my students, what is Ayurveda? Ayurveda is take one, get 99 free. So we have take one, get one free, take one, get two free offers. But what Ayurveda does is take one, get 99 free. Whatever complaint with which the patient comes, and if he has not explained or presented the other 4 or 5 symptoms, The patient will definitely come and tell, doctor, you have given me the medicines for X, but my MNOP symptoms are also gone. So that is the wonder of Ayurveda. So I gradually became his family doctor, and I'm happy for that. So case study 2. So a 30-year-old woman, so with a case of low back pain, not responding to any analgesics, and physiotherapy was administered. Ajamodadi churna, with freshly prepared Dashamona Kvata. So the stiffness reduced from day 2, second day itself. So very good medications these are. Pain was gone in 5 days. Her appetite and digestion improved. So radiology had not shown any pathology. So she had the history of taking untimely food and also traveling for her work. She worked in night shifts. Very important to take a note of the lifestyle. She had indigestion and loss of taste since 2 months. Lifestyle advices were given and was treated advised to take Kativasti, Abhyanga and Svedana for local relief of pain at weekends for few weeks. Because she was working, we can only format the patient to take the treatment for at the weekends. Okay, because if they can't get the leave, along with Matravasti of Gugulu Tiktaka Gruta. Okay, Kativasti was done, Abhyanga was done, Svedana was done, and Matravasti was given with Gugulu Tiktaka Gruta. Nothing much was done in this particular condition. So Matravasti was given with an intention to strengthen the back, not only to relieve the pain. So we need to mix and match. So Bahirparimarjana and also the internal medications, all these things we need to mix and match. Coming to part 4, diagnosis and treatment principles from the perspective of Shleshmasthana involvement. So the disease might find its feet in one of the Shleshmasthanas, as I have already said. If there is indigestion, symptoms of ama, symptoms related to any one or more of the above said sthanas, and especially if the 3 S's are available, it shall be treated on the lines of Amavata Chikitsa. 3 S's, very important everywhere. See the Shleshmasthana. So coming to the Shleshmasthanas, so head, it shall be considered as Tarpaka Kapha afflicted by ama. If there is headache, heaviness in the head, don't forget 3 S's. Okay, don't forget 3 S's. The 3 S's associated with ama, ajirna, and Agnimandi Lakshanas. And if the symptoms predominant to head, like headache, heaviness in the head, unable to rise up in the morning, all these things are found, then the Tarpaka Kapha involvement can be seen. If there is continuous salivation and other throat related symptoms, Modaka Kapha involvement can be seen. If more symptoms are seen in the joints, don't forget 3 S's, ama, ajirna, agdimandya, all this related. Chest organs, avalambaka kapha, stomach and intestine, kledaka kapha. Coming to one more case study. 40 years woman, she was one of my relative and had a severe exacerbation of breathing problem. See here, breathing problem like Shwasa, and I did not treat her on the Shwasa Chikitsa with tightness in chest and also the pain, shortness of breath, wheeze, incapable of expectorating. She also had severe cough. The symptoms were there for the past 15 days or so. It is an acute manifestation. It's not a very chronic one, acute over chronic manifestation. So she was known case of asthma. She had asthma, but these symptoms were there from the 15 days. So she was tired of taking the pills and inhaling assistance. She came to me for help. And she also had tried Ayurveda medications which are prescribed by her previous doctor for 10 days. She was treated for on the lines of Shwasa Chikitsa, but it did not give much relief. Then she had come at night time, so like 9:30 or 10 o'clock in the night, she had come driving to me, and she asked for help. I did not have many options. She had acute symptoms like chest pain, discomfort, wheezing, and other things. I had to give some medications. So I had Simmanada Guguru with me. I had some Ayurvedic medications along with Simmanada Guguru was there with me. So I gave her few tablets and told her to chew 2 tablets and drink hot water. So 1 hour later, I repeated the same treatment. She started feeling better. She was sent home. And then I had asked her to keep repeating the dose every 2 hours once until the symptoms came down. So within 36 hours, within 1.5 a day or 1/4 day, she became absolutely symptomless. So today she doesn't use any inhalers or modern medicines. She has become a big fan of Simmanada Gugulu and keeps it as a stock. She also calls them as emergency magical pills. Shwasam, Sudurjayam, Hanti, Kasam, Panchavidam Tatha. So this is the Palashruti of Simmanada Gugulu explained where? In Amavata Prakarana of Yoga Ratnakara. Palashruti of Simmanada Gugulu. In the Amavata Prakarana of Yoga Ratnakara, what the author tells, Shwasam Sudurjayam Hanti. Simmanada Gugulu is the best treatment for Sudurjaya Shwasa, for the dyspnea conditions or the breathless conditions which have become worst, and Kasam Panchavidam in 5 types of Kasa. So what do we know Simmanada Gugulu as? Simmanada Gugulu is best for Amavata, but you can see in Palashruti it is the best medicine for Shwasa and all types of Kasa. But where is the Palashruti? Palashruti of the best medicine for Kasa and Shwasa is mentioned in Amavata Prakarana. So what is the takeaway lesson? Follow the Palashruti very keenly. So because the best medicines for a Prakarana has been explained somewhere else. So diagnosis and treatment principles depending on the location of Ama and Amavata. So this is from Ashtanga Sangara Sutra's reference. I have extracted some things. So you need to see the area or location of Ama, where exactly it is located, and that also helps in the treatment. If the doshas are located in Amashaya, your treatment, the dosha should be expelled through the mouth, so that is through Vamana procedure. If the doshas are located in the intestines, they should be eliminated through the anal passage. Virechana is the best treatment. Doshas and Ama in the stomach should be expelled by Vamana, already I mentioned. And those in the Jatruda Pradesha should be removed by Nasya. All these principles we know. So coming to the section 3, the addition, some more added importance. The other important aspects of Amavata. Amavata has been compared to rheumatoid arthritis, rheumatic fever, polyarthritis nodosa, systemic lupus erythematosus, and Still's disease. So there are a few other conditions which the modern Pandits of Ayurveda compare Amavata to. So these are some of the conditions. So is Amavata a joint disorder? You can decide on that. Okay, so because the North Indian parampara has Amavata is equal to rheumatoid arthritis. In some parts of South India, we can see Vatarakta being compared to rheumatoid arthritis. So there is a difference of opinion between the schools of thought, but ultimately our vision will be Swastasya Swastha and Aturasya Vikara Prashamanam. If Amavata is joint disorder or joint disorder is Amavata, we are not worried as long as we make a proper diagnosis through Ayurveda and give medicines which can cure the symptoms. The patient just doesn't want the name of the disease. The patient will be interested in relief of the complaint. So do we diagnose Amavata as RA or RA as Amavata, being Ayurveda physicians? So I just tell diagnose Amavata as Amavata, because if you consider or equate Amavata with joint disorders, your study of the patients will shrink and it will come down to a small cabinet or a small box. If you study Amavata as Amavata, you have a broader horizon and a broader perspective of looking at the disease, as we discussed in different cases right now. You can see Amavata at Dhatu level, Amavata at Sutas level, at Shleshmasthana level, at Samprapti level, Nidana, Purvarupa, Rupa, okay, level, Supashaya, Samprapti level. So when we go on scattering, we come to know that Amavata is not just rheumatoid arthritis. Amavata is Amavata, and Amavata manifests in different ways. And when it is located at different places or different tissues and different organs, its manifestation will be totally different. So today's idea was to present this in this particular perspective. So importance of differential diagnosis, yes. Take Vata Shonita, Sandigata Vata, Asti Majjagata Vata and Samavata for differential diagnosis, and try to differentiate in an Ayurvedic way. Okay, so these things I'm not touching upon. The earlier slides were important for today's discussion. Importance of differential diagnosis already we have discussed while discussing the previous slides. So especially when going through the different srotasas, how do we look at, and when we take Amavata in differential diagnosis with Vatarakta, Sandigata Vata or anything, or when we are trying to correlate a modern conditions, or when we are trying to look at from the perspective of Haritokta types, differential diagnosis becomes very important, because if we know it as Amavata, whatever we have diagnosed, and if we have keenly reached that particular stage where we know the thick and thin of the disease. So, what are the things which are associated with Amavata there, including different elements of Samprati? That makes your treatment easy and handy. So, Upashaya and Anupashaya also will help in the differential diagnosis and also will come handy in treatment. So, modes of prevention, Nidana Parivarjana, and diagnosis and treatment of the disease in earlier stages. So, effective remedies, therapies, and my preferences in dealing with Amavata. I'll rush through the slides. Yeranda, we know as the captain of all the medicines in Amavata. Yeranda Paka, and we can use Svedana. So, in the form of Yeranda also can be used for Svedana in the Patrapinda Sweda. Yeranda Paka can be given for oral consumption. Yeranda can be used in as a multi-utility medicine in Amavata and in most of the diseases. In Amavata, Yeranda, yes. Gandharvastadi Tailam, Nimbamrutadi Yeranda Tailam, and Sindhuvara Yeranda have been my choices. So choose Gandharvastadi when it is neuromuscular, and Nimbamrutadi Yeranda Taila when it is musculoskeletal. So you can differentiate the use of these medications. So Yeranda Taila Brushta Vartaka. So the brinjal fried in castor oil, those people who love to eat brinjal, you can fry it in castor oil and give it. Again, the use of Yeranda. So moderners are against use of nightshade plants or the brinjal in the treatment of arthritis and in many other conditions. So here, because we are using the Samyoga, its impact will be different. And also the Samskara. So Panchakola, as I said, is one of my favorite and also very important medication. Panchakola Siddha Jala, Peya, Yusha, all those things you can include. You can see my favorite medications which are frequently used: Hajamodadi Churna, Vaishwanara, Shadharana, best Kashayas, Amrutottara, Rasna Panchaka, Rasna Saptaka. So these are some of the best Kashayas and Gutikas and Vatikas which I use in my practice. Simranada Gugulu S, I rank it as the specialist there. Rasadravyas, I don't use too many, so but definitely I use a few Rasadravyas in my practice. Amavatari Rasa and Amavata Vidvamsini Rasa have been good. So coming to the Basti, yes, it is the best treatment to prevent the recurrences and also to avoid the further progression of the disease. You can consider one of these things. Combined growth Saindavadi Taila and Gugulu Tiktaka Gruta are always best in Anuvasana. I generally mix both of them. So you can take Erandamuladi, Dashamula, or Vaitranavasti, whatever. If the patient's tolerance is less, the same Kashaya Vastis you can use in Kshira format, that is Kshiravasti. So if there is sufficient ama and if the patient is tolerable, you can avoid Kshira in the Basti. Bhyopakramas, all these things we know: Dhanyam Ladara, Bashpasveda, Avagaha. So recently I was telling about Amavata to some students and to another institute in one of my webinars, and they were not from North India. They were not very familiar with Dhanyam Ladara and those procedures. They were really fascinated to know. So we in South India know a lot of things about Dhanyam Ladara. So we know its efficacy in treating Amavata also. So Bashpa Sweda, Avagaha Sweda, Parisheka, Churna Pinda Sweda, you can go according to your yukti. You can use a lot of them. So yeah, so my favorites in dealing Amavata again. So the ingredients and benefits, just I have mentioned as a part of the table here. In which conditions it can be given. One or two, I'll just give an example. We're running out of time. Rasna Panchaka Kvata, you can consider when there is Sarvangavata, Sandhi, Asti, Majjagata Vata, and Amavata. Or you can take Amavata located at Sarvanga level or in the Asti and Majja level. You can go for Rasna Panchaka Kvata. Okay, when it is complicated, because you can see the Panashruti, Sudaruna Amavata has been mentioned for Pipalyadi or Panchakola Kvata. Panchakola Kvata, Sudaruna Amavata. You can use it for an extended period there. So like this, I have mentioned a few medications with their ingredients and Shastrokta benefits and also according to my clinical practice. Shunti, Guduchi, Kwata, right down at the bottom you can see Shunti and Guduchi are the two ingredients, that's all. Amavatam, Chiraya, Sandhi Samshritam. So there are only two ingredients here, but the author tells Amavatam, Chiraya, Sandhi Samshritam. So if Amavata is located in the joints for a long time, it has become chronic, you can use this Kwata. So what is the conclusion? More number of drugs or more number of herbs doesn't indicate treating the chronic condition. Sometimes simple formulations can be. So you can see Rasna Panchadashaka Kwata there. So there is Rasna, Guduchi, Shunti, Devadaru, Dashamola, Indrayava plus Eranda Taila. In Dashamola again we have 10 herbs. Panchadasha, we have 15 ingredients with Eranda Taila, and see the Palashruti, it has just been mentioned as Amavata Hara. That's all. And when we come to Shunti, Guduchi, Kwata, there are only two ingredients, Shunti and Guduchi, and it is prescribed for the chronic condition. Okay, so like this Shunti, Gokshura, Kwata, you can see it is, if Amavata is located in Kati, it can be used, and Katishula it can be used for as an analgesic, Rukprashamana, and also for Pachana, you can use Shunti, Gokshura. Gokshura again correlate with Harita's explanation. Basti has been mentioned many times there. So planning the Patya. So you can see Yusha prepared with Shushka Mulaka, Panchakola or Konji, mixed with the Shunti, Kulatta, Yusha. This can be Erenda Bija Payasa, Panchakola Siddha Jala. All these things are can be used for Patya planning. So Ushnodaka boiled to half. We have a reference like when you reduce the water by half, like you take 1 liter and reduce to half and make it 500 ml. So it acts in a very good way, like Kapha, Meda, Vata, Ama, Jwarahara. So it relieves Kapha, it relieves Meda, Vata, Ama. So hot water itself in the earlier conditions can act like a Patya. Avoidance of etiological factors, Nidana Parivarjana is very important. Apatyas, yes, there are so many apatyas which we can forego or avoid. So for Deepana, each of Panchakola is the best one, Maricha, Ajamoda, and many other Deepana Pachana Dravyas. There's a list of Pachana Dravyas here because we are discussing about Ama. So best Vatanulomana, Vatahara Dravyas. I just made a list of these things. So as I said, the initial slides were very important for our discussion. Best Truptikna Dravyas can also be used for Amavata. Treatment Rochana, because there is Aruchi and the involvement of stomach and intestine, and Arochaka, Agnimandya, and Ama formation. All these things will come in handy there. Best Patya Kalpanas are always Manda, Peya, Vilepi, and Yusha. Explained in our Samsajana Krama. They can be used anywhere, medicated or non-medicated, Kruta and Akruta. So simple preparations effective in Amavata. Again, I made a list of this. Already we have discussed a couple of things. Shunti Gokshura Kwata, Shunti Guduchi Kwata, Panchakola Kwata, Shunti Churna mixed in Kanji, yes, for internal intake, really good. Dashamola Kwata with a sprinkle of Pipri Churna will give very good relief in initial conditions. And the last section for my and for your relief also. So we had a lengthy session. I think I've encroached and taken more time. So points to focus in making diagnosis and treatment of Amavata in a classical way, easy and effective. So you can see the summary and tips for diagnosis and treatment of Amavata. Since most diseases are caused by Agnimandya, our primary intent and content will be looking at Agnimandya, looking at Deepana, Pachana, and Srotoshodhana, herbs, and the formulations in these particular conditions. When you find Ama in those conditions or symptoms similar to Amavata, you have to be ready with these formulations. So know the symptoms and stages, how to know them. In the earlier stages we have discussed. I am just summing up the discussion. So when the disease is at the gut level, like Samavata Lakshanas or the Samanya Amavata Lakshanas are found, manage it with just Langana, Pachana, Deepana, and Svedana. No need of going to the higher treatment unless required. So when there are Sarvanga Lakshanas and when it is complicated or when it is a chronic case, include Virechana, Vasti, and Snehapana into the treatment. So do not forget the external therapies. As I've already mentioned, look for dosha association and also treat accordingly. That we should not miss. So treat the earlier stages on the lines of Ama Chikitsa or Samavata Chikitsa. Later, when the Ama gets relieved, you can go and treat the condition on the lines of Vata Chikitsa if Vata symptoms are remaining. See through the Sama and Nirama conditions also. You need to analyze in which condition Sama is present and which condition it is not there. Your Upashaya and Anupashaya will come into help. Snehana, Brahmana, and Balya medicine should be brought into the play in later conditions. So areas of exploration in treatment of Amavata, you can also look at considering Shota Chikitsa, Jwara Chikitsa, Ajirana Chikitsa, Agdimanda Chikitsa. You can find clues of treating Amavata in these prakaranas also. So think different. That is what I want to tell. That is the basic intention of today's presentation. If Amavata has been developed on the backdrop of some other disease, like if Amavata is itself a Anubandha Vyadhi, or Nidanarthakara Vyadhi, it has been caused due to some other disease, you first treat that particular disease. That is also important to note here. If it is Anubandha Vyadhi or Upadrava, Amavata is a complication of some other previously existing condition, all these things we need to take into consideration here. The treatment of Pradhana Vyadhi itself will take care of the symptoms. That we need to remember. If not, get a formulation or two from the Amavata Prakarana. So thanks for patient hearing, and my heartfelt thanks to IASK Ayush team, and I extend my compliments and best wishes to the team for their exemplary work done by them towards Ayurveda and towards educating people, students, Ayurveda enthusiasts in terms of Ayurveda, and especially for giving me an opportunity to speak and present Amavata in this particular perspective, that is only the Ayurvedic perspective of its diagnosis and treatment principles. I especially thank Dr. Ilan for contacting me, and Dr. Samuel for coordinating with me later, and also the coordinators of this particular session. You can find my details here. So kindly be free to contact me. Thank you. So let's end the session here and stop sharing the slides.
Yeah. Thank you so much, sir. So that was really a wonderful presentation, sir. In detail, you have explained about the diagnostic method and the treatment principles of Amavata. So it will be really a great help for all the Ayurvedic Vaidyas and in detail on different aspects and on different types of accordingly to as you have explained about Harita. So everything was in detail. So as the time was also extended, so it was really a wonderful presentation, sir. So
Thank you so much.
I would like on Miss Devi Priya for the vote of thanks for this session.
At the same time, Dr. Hari, so just so hopefully I have not encroached. I think I have encroached the time limitations. So because it was a lengthy presentation, as I said in the beginning, if there are any questions from the viewers or the students, you can keep me posted so that I can reply those questions later.
Sure, sir. Sure, sir. So those questions will be posted, sir.
Definitely. Thank you.
Sure, sir.
Honorable Speaker,
So,
respected doctors, all my friends, and all the viewers. It's my privilege to propose a vote of thanks on the special occasion. I, on behalf of IS Kayush and on my own behalf, extend a very hearty vote of thanks to Speaker of the Day, Dr. Raguram YS, for gracing your important work and sharing your knowledge with us. Thank you, sir. Really, people like you are charming gardeners who make our souls and mind blossom.
Thank
Our
you. Thank you so
sincere
much.
thanks to you, sir, for your efforts on Easy Ayurveda website also.
Thank you so much. Thank you.
We have been fortunate enough to be backed by a team. Thank you all doctors. Hope meet you all soon later. Thank you for being
Thank you,
with us.
Dr. Hari and Dr. Devi Priya also. Thank you for everything. Thank you.
so much, sir. Thank you, sir. And thank you
Thank
all
you.
the viewers.
Thank you. Thanks to all the viewers, and especially thanks to my mother institution, A.L. Rao Ayurvedic Medical College, Kuppa. So I also dedicate this talk to all my students, extended family of students in my institution and everywhere, and also to my mother institute. Thank you.
Thank you, sir. Thank you so much.